extreme pleasure in meeting you. Ma'am, we are the students of SI University. Came as a part of our SI University to take an interview as a part of our life skills course. That is interview and expert. Ma'am, with your permission, can I introduce you my teammates?
Sure.
I am Yashvita from CSC first year. She is Vardhini.
Hi, Vardhini.
Abhishek,
Hi, Abhishek.
Yashwant and Rishi.
Hi, Yashwant. Hi, Rishi.
So, we are going to start with a self-introduction of ma'am. She is B. Sangeeta and she completed her MBA in Finance in Sardar Patel College, and she worked as an assistant professor in Sardar Patel College, and she was awarded a gold medalist in Usmania Graduate Association, and this was a self-introduction of B. Sangeeta ma'am, and also she was the managing director of Vijay Lakshmi Hospital. So we are going to start our interview, and we are going to start the first question of our interview. And the first question will start by Yashvita.
Can you talk about your experience as a managing director in Vijay Lakshmi Hospitals?
As you know, all humans are not same. Every human will be having an individual personality. So as is in a hospital field, there are many people we come across every day. So there are few patients who come with lot of problems and they express their problems, and we try maximum to reach their, to solve their problems. So as a managing director, I can take their problems, like financial problems, maximum their treatment will be done by the doctor. But after the treatment, definitely they'll come for the payment of the treatment. So maximum we'll be talking to them about their financial problems. So when there are few people who are in a position how cannot pay, so definitely we'll show a lot of kindness to them, and we will maximum will be decreasing their treatment expenses. So at that moment they will be feeling very happy and they will be blessing us. You have to continue and you have to grow to next level. So when they bless us like that, we feel very happy. And there are other set of patients who come with a lot of rude attitude, and even they also they will be telling that how much will you cost for this treatment? This treatment will be done for less expenses in other cities. So how can you charge this much? So for them, we'll definitely explain in a polite manner. We'll tell them what are the resources that we are using for the treatment, how much expenses we are paying to treat them. So we'll explain them everything and we'll send them with a good satisfaction. So there are people who come with an argument, there are people who come with problems. So we equally satisfy this side people and that side people. And our job is like a roller coaster. One day it will be very happy and other day it will be full of arguments and fights in the hospital. So definitely we'll manage both, and of course there will be a stress. It is a stressful job, it is an happy job, it is an emotional job, as there are patients who come and tell their emotional problems. So it is like a roller coaster.
And why did you think to choose this profession? In order we have many more professions.
Yes. Actually, there are a few fields where we can serve people. There are many fields to serve people. As I am an MBA graduate, I feel to serve people through this profession. So how can I have thought in that manner. So I can serve people through my education also. That is what my management skills are. So through my management skills, I thought to serve people and I have choose this healthcare center. And previously, as you told Abhishek, I am as assistant professor. Even that teaching is also a service to people. So I choose that field for serving people, and I choose this field also to serve people. So my main motive is to serve people.
We got a magnificent answer from you. And we're going to start the next question. And the question was, what do you do to make patients happier and healthier?
As I told you, service. Service is our main motive. So I feel not only in healthcare center, it might be other fields also. It might be restaurant, it might be cinema halls, it might be education centers. When we are rendering service in an excellent manner, definitely the customer will be happy. And here, coming to the patients, we are rendering service through doctor, we are rendering service through nurse, we are rendering service through providing good rooms, good equipments, timely services. So these all comes under service only. So when I am giving a proper service and a satisfying service, definitely they will be happy. And we go to rounds, we ask every day morning, we'll be going rounds and we'll be asking about the cleanliness of the room. We'll be asking them the services provided by the IRs, like room services, electricity, and we have generators, so they will be having 24 hours current. As this Husnabad is not an developed city,
Yes.
there will be fluctuations in electricity power.
Absolutely.
So we also considered those problems, and we also established a generator, so they'll be having current, they'll be having 24 hours water services. As these all services are provided in timely manner, so definitely they are satisfied, and their satisfaction is ultimately a profit.
And if something goes wrong or your staff doesn't go through the rules, what are the measures will be taken by you?
As I have to thank my staff, as this was a secondary case, like if they don't follow. So actually they'll follow. Every week we'll be having staff meeting, and every month we'll be having staff meeting. We'll be having meeting with doctors. We'll be having as well as with staff members also. So the staff will be having direct interactions with us, and even the doctors also will be having direct interactions with us. So we are the mediators, and we are like support pillars either for employees or for doctors. So definitely we'll take two sides problems, and we'll definitely choose which have to be, like all problems might not be solved at a time. So that's why we'll follow the rules, like a dress code about the employees, their punctuality, and they have to submit their mobiles, like there should not be any distractions to the employees. So they submit their mobiles here, and when they go for lunch, they all together, they doesn't go at a time. Two sisters will be here and two sisters will be going there. So we manage like this. I'm explaining you how we are managing
Yes.
this, okay?
How we are segregating the time
Yes.
between them.
And when we are coming to reception, everyone does it at a time. One will be going when they reach, and the other person will be going.
Yes.
Pharmacy, everyone will be following the same pattern. So there is no chance of like there is no employee. Like when the patient is waiting, definitely we'll be having a nurse over there, reception over there, pharmacist over there. So it is not like no doctor, no patient. So this is because we are following such type of rules. They have to come on time, they have to leave after the reliever comes. So the patient and the employee, they have to be simultaneously at a time.
The next question is, sorry. Can you give an example of something you did to make the hospital better?
So as I told you, there are no proper equipments in other hospitals.
Yes.
So we started a sophisticated OT room.
Yeah.
Like we'll be having every equipment. We understand the patient requirement. Now today if I don't have one equipment, absence of that equipment made a trouble. So we'll understand that. We'll understand it, and the next moment we'll be purchasing that. Same way, now there are many patients who cannot pay cash.
Yes.
As Sir told, we also implemented insurance. So people who cannot pay cash, they can go for cashless treatment also. So we started treatment for insurance, and we talk with the third parties, and for government employees we have reimbursement. So we take all these opportunities to treat people like who are not like capable of finance.
As per the convenience, you are.
As per their convenience, who can pay, they pay cash. Who's having online, they can pay online. Who want to pay with insurance, they can pay with insurance. So we have all types of facilities for them.
Ma'am, being a managing director, you try to make your patients comfortable. But ma'am, what do you do to make your staff comfortable and feel good?
We provide them like now maximum an employee. It might be me or anyone. We will be spending almost 14 to 15 hours in the hospital. They will be spending 9 hours. So when they spend this much time in the organization, so definitely that environment has to be like a home. So we make sure that every employee is comfortable with the other employee. So we ask for their conflicts. Is there any conflict happening in the group? It might be any department, sister department, reception or pharmacy or lab. We have 4 types of departments. So every department will be having a connection with the other department. Now if I'm like a sister department is only for sister department, then there will be no rapport between the lab and sisters. So the communication will not happen. So we make sure that they communicate with each other. Sisters have to go to pharmacy. because they have to talk with the pharmacist. In the absence of pharmacist, they have to take the medicines and give it to the patients. So in this way, we make sure that every department is interlinked with other departments. And that environment brings them that, okay, we have a lot of people here to spend and to like evolve, like increase their knowledge, to know more about the field, like as it is gynecologist field, to know more about the ladies' problems. And my staff has a benefit like they can, they'll be having percentage discount in the OPs, they'll be having percentage discount in the pharmacy because they are working for us. So definitely we make sure that they are happy and comfortable here, and they can, they'll be having free OPs when they consult ma'am, gynecologist ma'am. When they consult, they'll be having free OPs. In medicines, they'll be having 50% discount because we want our employees to be happy and they should think that I have to be in this hospital, I have to work in this hospital. They should not even get the second chance to go to another hospital because we are their benefiters and they are our benefiters. So in that way, we make sure that they are happy.
The next question is, see, like most of the people visiting the hospital, there will be, as per the status, there will be some rich people and the poor people. How equal treatment you are giving for those people, like even though they are professionally very good, or like somewhat like few people like they have good professional life. So how respect you are giving to those people? How are you showing equality to all the people, or like see if any professional guy like an MLA or some other person has came to the hospital, so or the same side a poor guy has came, how you look after the both people? Because you need to give respect, because the hospital, the rule is that you need to treat every people equal. So how you will take care of that? Do you experience any situation like this?
We have experienced many times.
And also you share that experience also.
Like as you told, MLAs, or we call like there are many politicians actually in Husnabad. Politically, Husnabad is very high, I can say. There will be many people like, I don't want to mention anyone's name or I don't want to mention any profession, but there are people, they come and they will be showing such type of attitude that, yes, I'm so and so person, why are you making me, like, we make sure that everyone goes in an order. That's why we give them numbers, serial numbers. So if anyone is going to obligate that they are they are going against rules, definitely staff will be scared. There are many situations like they will be making an argument over there. They will know who am I? How can you make me to wait? She is my wife. There will be in calls also. In calls also they will be calling, my wife is waiting from 1 hour, send her early. We make sure that we explain them. There are many, every person is coming here for a treatment. There are emergency cases. This is an exceptional case. Sometimes we will be sending patients not in a serial manner. When it is in a case of emergency, if a person is number 89 and the number is running in 20s, if that 89 patient is in an emergency case, we will send her. In this type of situations only we will be sending her, otherwise we cannot send in that way. Like we will be explaining them in a polite manner. If they don't listen, we can't stick that person and sit over there, or we can't keeping on argument with them. So I'll definitely say that if it is an emergency, I'll respectfully I reject that OP. You can go to another option. Because for one person, I cannot take a blame from 10 patients. I cannot dissatisfy 10 patients. So I make sure that if you are okay to wait, you can wait. Otherwise, you can go. Okay, we are telling them in a polite manner.
My being a director manager, you have seen the good side of the hospital and also the bad side of the hospital. If any emergency occurs, like any fire accident or something, what will you do?
Like as you told, we have fire extinguishers if any case. That's why we make sure that no inflammable things enters into a hospital. That's why we have an OT boys who will be sitting near the entry, and they will be definitely taking care of that. No one is carrying something which is violent to the hospital. And in case if any, like suppose an operation is happening in the morning, if there is a power cut, that is also a problem. That is also a emergency case. So for that purpose, we realize that there is an importance of inverter and generator. We have also purchased a generator. So what here is, we never take a step back for the purpose of the welfare of patient. So we make sure that everything, whatever a patient needs, and I am not telling you that everything we know and everything we are implementing. Our experiences also making us to know what is important for a hospital. First, we don't have generator. We understood the importance. We got it. We don't know the importance of ECG. Later, we got ECG. So these experiences are making us to know what is important and what is not. So according to that, we are growing, we are purchasing things, and we are improving, we are updated. Yeah.
And the next question is that about we want to know the leadership you are maintaining as a managing director in this hospital. Can you tell us about a tough decision you had to make as a managing director in the hospital and how you made it? Any tough decision you have taken by yourself?
Tough decision. Sometimes openly telling you, staff will be coming here and they will be telling that we have that family problem, this family problem. So they ask me in time changes. They ask me in leaves. So I make sure that every employee have to get an equal opportunity. Now if I'm going to show favoritism to one person and the other person will be feeling bad. So I make sure that everyone will be having same leaves, and if I'm giving an exception in one case to her, I'll be giving an exception in other case to you. I cannot be tough, I cannot be too lenient. I have to manage. That's why I'm a managing director. So I will be managing. I never got a tough situation, but we handle situations in a proper way. We talk to them and we make sure that this, every how many 22 employees we have. 22 employees will be satisfied in that way.
And finally, ma'am, any suggestion? What was the suggestion you want to give to the youth?
As I told you, I choose this field according to what I have done is my education should not be going in vain, and my thought which way I have to serve people, that should also not become an big. So I thought my education should work in some place, so I have choose this field. In the same manner, everyone will everyone will be having different types of field to serve people. So you can also, you in the sense, you can also choose those type of field to serve people. Now I cannot directly serve country, so I am choosing a particular field. That way everyone will have to choose their particular field, and that leads to service to the country. So small aggregation will become a big. So that's why in that manner, as we have seen in Stalin movie, one person have to help three, the other three have to help other three. In that way, it will be spreading. So even like that, we also should spread the service to the public.